My name is Dr. Michael Derry. I am a concierge physical therapist here in Jacksonville, Florida, and I treat back pain all the time. And as being a physical therapist, when I'm treating back pain, we always go over some education. And today I thought it would be great to go over 10 absolute facts about back pain. We're gonna be talking about age, posture, surgery, and more. This will be worth listening to. I know this is gonna be some new information for you. Stay tuned, watch all of them, because I know you're gonna get a lot from it. If you guys like the content, please subscribe and just engage with me. Leave some comments underneath the description. Otherwise, let's go over those 10 facts right now. First fact I want to talk about is surgery and drugs. They are not the answer to your back pain. Some surgeries are successful for sure, laminectomies and different surgeries for fusions, and if you really need it, success can be reduction in leg pain or improvement in back pain, but they are not the long-term answer. Back health is determined by a long-term commitment to improving your health, your mobility, and your strength. And so while the every now and then ibuprofen or muscle relaxer can help you get through some tough times, that's not your fix. To fix back pain takes hard work and a long period of time of just dedicating to your body to improve your overall health, your spine mobility, and everything that surrounds your spine. They're never the answer, but sometimes they can be a nice intermittent break, but they are not the fix. Number 2, flare-ups are completely normal. It does not mean that you're having increased damage in your back. Let me give you an example. If you're having a great day and your back is feeling amazing, let's do an MRI of your back. And then on a day that, let's say the next day, or you go walk a lot or do a lot and you're in a lot of discomfort, let's do an MRI again. And I guarantee that those MRIs will be the same. Structural change doesn't happen that fast. Now, I'm not saying your pain doesn't change that frequently or that quickly, but what I'm saying is structural change doesn't happen that fast. So your flare-ups are not correlated or causing any structural change in your back that quickly. That's super good to know. Flare-ups does not mean damage. So if you work out and really sore or uncomfortable, it doesn't mean you damage your back. Damage does not happen that quickly. The third one here, I'm guilty of this. A weak core does not cause back pain. Back pain is a much bigger thing. It's not just influenced by your core. It's influenced by your overall strength and your mobility and your thoughts and feelings. But to say that your core strength is your weak core is causing your back pain, the correlation and causation is not there. One does not equal the other. And so if we thought like that, that would mean that if we had no back pain, we would think we had a really strong core. And that doesn't happen either. So a weak core doesn't necessarily cause back pain. A weak core and many other things, or how your body is looking in that moment, may be causing or may be leading to your back pain more likely than the weak core. And so just keep that in mind. Your weak core does not equal back pain. Fourth fact here, we're going to talk about wear and tear. Wear and tear, or using your back every day with everyday activities, doesn't wear your back out more. It's not like you're wearing out your discs or wearing out your spine faster because you're more active or because you're doing a lot in your day or your job is really demanding. It doesn't work like that. In fact, the more active you are and the more you do, the better off your back feels. Let me tell you something else too, is there's a law called Wolff's Law, is that your body adapts to the demands you put on it. So actually the more you move and the stronger you are, the better off you're going to be. So your back doesn't wear out over time with normal daily activities. Poor posture does not cause back pain. Trust me, I really want to tell people, hey, because you have poor posture, you're going to have more back pain. That's been found not to be true. There's tons of people who have awful posture and no back pain at all, and people who have really good posture and have back pain. So one does not equal the other. We're seeing a trend here, but in this consideration and this fact, posture does not mean you're going to have back pain. Now, if you have awful posture, among other things, we may be doing exercises to improve your overall posture and ability to stand up, but I'm not going to tell you, hey, if you improve your posture, your back pain is going to absolutely get better. What ends up happening is that we focus on improving your posture, improve your strength and mobility, and your back pain gets better. And so it's not the only variable that impacts your back pain. Posture or poor posture does not equal back pain. Number 6, pain with movement or exercise does not mean you're doing harm to your body. And what I mean by that, in the classic example I give my clients, is that let me see your finger. I apply pressure and I put pressure until it becomes pain. And then we look at your finger. Did I actually do damage? right? And the answer is no, I didn't do any damage, but pain is your body's perception and fear of damage being done. And so your back can absolutely be sensitive to the touch and sensitive with exercise and stretching and mobility, but no damage is actually being done. And that's when dosage becomes really important. Dosage of manual therapy and hands-on work, or dosage of exercise, in that you don't want to push past that sensitivity, but we want to do enough to actually reverse that. We can make you less sensitive to the movement and less sensitive to the touch through some very specific things. And so, are you doing harm to your body when something is uncomfortable? No, you're not. And so there is no damage being done when something is painful. Number 7, when you've had pain for a long period of time, does that mean that you've had damage for a long period of time? No, right? We know that in about 6 to 8 weeks, most tissue healing occurs. And so scar tissue will go down, the inflammatory process will calm down a little bit. So in 6 to 8 weeks, normal tissue healing time is kind of taken care of. Let's even expand that 10 weeks. But if you've had pain for 3, 4, 5, 6 months, tissue damage being found on an MRI or X-ray or other imaging probably isn't going to happen. I'm not saying you don't have pain. What I'm saying is that the tissues are probably relatively okay. There may be some sensitivity and some weaknesses and some imbalances, but actual tissue damage doesn't happen like that. And so the longer you have pain does not mean that the longer you've had tissue damage. The 8th fact I want to talk about is that if you had pain for a long period of time, does that mean your future is doom and gloom? No, absolutely not. People can recover from pain and get over chronic pain. It definitely does happen. It takes some work, but the longer you've had discomfort doesn't mean the closer you are, the more likely you are to ending up in a wheelchair or being on disability or something like that. So you can improve, it does get better, but it does take some hard work. Number 9 and 10 are probably my favorite. So the 9th being, does age cause back pain? No, not at all. I treated plenty of older adults that have what I would consider a pretty rough looking back, and they have no pain at all. And I've got other adults that I treat that have a relatively nice looking spine and MRI and have pain. And so the older you are means more likely you are to have the definition of arthritis and stenosis and degeneration, but that doesn't mean you're going to have more pain. That's amazing, right? That would mean that as we're getting older, that everybody's retirement years are going to be awful, but that's not the case. And so the older you are doesn't mean you're going to be more likely to have pain. The 10th fact comes from MRIs and X-rays. Can your pain be found on an MRI or X-ray? No, and 90% of the time, we cannot determine your pain based off of what's found on the MRI or X-ray. And a lot of those times, those images are useless because I've seen plenty of patients that have had pain and they find something on MRI and it doesn't match up with what they're feeling. And the other way around too. I've had a patient where I feel like their pain is coming from a disc herniation and sciatica, and they have the MRI and it doesn't pop up, it doesn't show up. Well, that doesn't mean it's not there, or it doesn't mean that that's not what we should treat. And so the MRIs and X-rays often add cloudiness to the situation. And so best evidence says wait 6 to 8 weeks, and if you're still having discomfort, then the MRI or X-rays can add some value to your plan or your recovery. But until then, stay away from it. They are not your answer. MRIs and X-rays will not tell you the cause of your low back pain. Based on how you move and feel, we have a better chance of telling you the cause of your back pain. Guys, I hope you guys enjoyed those 10 facts about lower back pain and recovery. Those are things that I talk with clients all the time. And if you can really grasp those and take those to heart, they can really make a big difference on your recovery or your best next step or your fear related to movement or really just the confidence moving forward in your life. And so if you guys like the information I'm putting out there, please subscribe to the channel, engage with it, leave a comment, and I'll get back to you. But I just really want to know if that's useful to you guys. 10 facts about low back pain. We covered those today. Put those down in your brain. That's what best evidence says right now about back pain. Guys, as always, stay healthy, keep moving, and take care of yourself.